Chronic Obstructive Pulmonary Disease, or COPD, is a serious lung disease. It is a condition that affects millions of people around the world, making everyday activities like walking, climbing stairs, or even talking a struggle. It makes it hard to breathe. People with COPD often experience shortness of breath, wheezing, and a chronic cough that produces mucus. Over time, it gets worse. The symptoms can become more severe, leading to frequent hospital visits and a significant impact on quality of life. COPD is a group of lung diseases. It encompasses conditions that cause airflow blockage and breathing-related problems. Emphysema and chronic bronchitis are the most common. These conditions often occur together and can vary in severity among individuals. Emphysema damages the tiny air sacs in your lungs. These air sacs, known as alveoli, are crucial for oxygen exchange. These air sacs are called alveoli. When they are damaged, it becomes difficult for your lungs to absorb oxygen efficiently. This damage makes it hard for your lungs to absorb oxygen. As a result, you may feel constantly out of breath and fatigued. It also makes it hard to get rid of carbon dioxide. This buildup of carbon dioxide can lead to further complications and exacerbate breathing difficulties. Chronic bronchitis is another form of COPD. It is characterized by a persistent cough that lasts for at least 3 months and recurs over 2 consecutive years. It causes inflammation and mucus buildup in the airways. This inflammation narrows the airways, making it even harder to breathe. This makes it hard to breathe. The excess mucus can block the airways, leading to frequent infections and further lung damage. COPD is a major health problem worldwide. Smoking is the primary cause of COPD. Cigarette smoke damages the lungs over time. This damage leads to the development of COPD. Other environmental factors which contribute is exposure to secondhand smoke. Air pollution, both indoors and outdoors, can also damage the lungs. In some cases, COPD is caused by genetic factors. One such factor is a deficiency of a protein called alpha-1 antitrypsin. This deficiency can lead to early-onset COPD. COPD often develops slowly. Early symptoms may be mild, just like persistent cough with mucus. Shortness of breath, especially during physical activity. Wheezing is another common symptom. This is a high-pitched whistling sound when you breathe. You may also feel tightness in your chest. Early diagnosis and treatment can slow the progression of COPD. Smoking is the most significant risk factor for COPD. The more you smoke, the higher your risk. Age is another risk factor. COPD is more common in people over the age of 40. Exposure to environmental irritants includes secondhand smoke, air pollution, and chemical fumes. Also, if you have a family history of COPD, you may be at increased risk. Diagnosing COPD from symptoms to spirometry. Diagnosing COPD starts with a comprehensive medical history and a thorough physical examination. This initial step is crucial in understanding the patient's overall health and identifying any potential risk factors. Your doctor will ask detailed questions about your symptoms. A spirometry test is the most common and effective way to diagnose COPD. During the test, you will be asked to take a deep breath and then exhale as forcefully as possible into a mouthpiece connected to the spirometry device. This measures how much air you can inhale and exhale, providing valuable data on your lung capacity. It also measures how quickly you can exhale, which is an important indicator of lung function. The results can help identify the presence of airflow obstruction, a hallmark of COPD. In addition to spirometry, other tests such as chest X-rays and CT scans may be used to rule out other conditions that could be causing your symptoms. Breathing easier. Treatment options for COPD. Chronic Obstructive Pulmonary Disease, or COPD, is a long-term condition that requires ongoing management and care. While there is no cure for COPD, there are effective treatments to manage the symptoms and slow its progression. Bronchodilators relax the muscles around the airways, making it easier to breathe. These medications can be short-acting for quick relief or long-acting for ongoing control. Inhaled corticosteroids reduce inflammation in the airways. They're often used in combination with bronchodilators to provide more effective symptom control. Oxygen therapy may be necessary for people with severe COPD. It helps to increase the amount of oxygen in the blood. This therapy can be administered at home, allowing patients to maintain their independence and comfort. Pulmonary rehabilitation is a program of exercise, education, and support. It is designed to help patients improve their lung function, increase their physical activity levels, and enhance their overall quality of life. Lifestyle modifications, your ally in managing COPD. Making lifestyle changes is crucial for managing COPD effectively. These changes, combined with medical treatment, can significantly improve your quality of life. Quitting smoking is the most important step you can take. Smoking cessation programs and medications can help you quit for good. Regular exercise is essential for maintaining lung function. Start slowly and gradually increase the intensity and duration of your workouts. Eating a healthy diet is important for overall health, including lung health. Focus on fruits, vegetables, whole grains, and lean proteins. By staying informed, advocating for your health, you contribute to the fight against COPD and pave the way for a brighter future.